Hi students, today we are going to discuss about the acid-base balance and acidification of urine. Actually, the kidney plays an important role in maintenance of acid-base balance by excreting the hydrogen ion as well as to retaining the bicarbonate ions. Normally, the urine is acidic in nature with potential hydrogen 4.5 to 6 metabolic activities in the body produce a large quantity of acids with a lot of hydrogen ions which threaten to push a body towards the acidosis. However, the kidney prevents by these two ways. One is a reabsorption of bicarbonate ions, and another way there is a secretion of hydrogen ions. Followed by that, we are going to see that what is the importance of the maintenance of acid-base balance. So, maintenance of acid-base balance within the limit normal range is important for enzymatic action and for other cell functions. Hydrogen ion concentrations of body fluid and blood is maintained the constant within a narrow range, although metabolic acids are continually produced in body because of various buffer systems. So now we have followed by this slides, we are going to see that what is the potential of hydrogen. So who will be discovered. So the concept was introduced by the SPLS Renson in 1909. So now we have to segregate the what is the acid, what is the base. So we seen this one is the acid base balance. So we have to segregate this what is the acid and what is the base. So what will happen in the hydrogen ion and the acid, what's happened in the hydrogen ion in the base, hydrogen ion will be releases in the acid and hydrogen ion is being accepted in the base. And followed by that we are going to see about this. There is a potential hydrogen different in the different fluids. I just mentioned there is a arterial blood, venous blood, and interstitial fluid, intercellular fluid, urine, and this is the hydrochloric acid. Next we are going to see about this, what is the buffer systems. So the buffer system to provide or remove the hydrogen ion and stabilize the potential of hydrogen. Now we have to know about this one also. Is include weak acids that can donate the hydrogen ions and weak bases that can absorb the hydrogen ion. So does not prevent the potential of hydrogen change. So the term they used to call, the term is alkalosis refers to excess removal of hydrogen ion from the body fluids in contrast to the excess addition of hydrogen, which is referred to as a acidosis. Now we have to know about this one. So why we have to see the acid base balance. So what will happen if there is a acid is going to be more acidic. So if there is an imbalance, what will happen? So what are the difficulties the person will be felt? So now we have to know about this. What happen if body is too acidic? So what happen? There is a decreased ability to absorb minerals and nutrients, and decreased energy productions, and decreased ability to repair damaged cells, and decreased ability to detoxify heavy metals, and enable tumor cells to thrive, and susceptible to fatigue and illness. So these are the difficulties the person have to feel. The person will be affected. The body is too acidic. So I hope you easy to understand. So what is the acidosis? What is the alkalosis? Here there is a normal range. So this is a potential hydrogen scale have been mentioned. There is a less than 7.35. This is considered as acidosis, and is a more than 7.05. This is considered as alkalosis. Now we have to know about this one. So body produces more acid than bases. How can this possible? So acid will be taken in the foods. Acid will be produced by metabolism of the lipids and the proteins. Cellular metabolism produces the carbon dioxide. Now there is carbon dioxide mixed with the water is a bicarbonate, and is a just releases the hydrogen and just going to be just segregated as a carbonic acid. So per day it will be 80 milliequal per liter, and hydrogen ions will be formed. So by this way we are easy to understand the body produces more acid than the bases. So I would like to important thing how to say, suppose how to as acid base balance only it be just maintained by the kidney or some other region also. So now we have to go through that. One is a buffer in blood as well as and body fluids, And respiratory mechanism and renal mechanism. Renal mechanism is one of the mechanism to maintain the acid base balance, but here only there is a maximum hydrogen is going to be make the reabsorption be takes places. That's why we are going to be just give the more concentration in the renal mechanisms. So if there is a renal mechanism, so what are the role of kidney in acid base balance? The kidney are responsible for the eliminating from the body metabolically produces non-carbonic acid like the sulfuric and phosphoric acids, a smaller amount of the hydrochloric, lactic and uric acids. The primary role of the kidney in acid base regulations is conserve major cation and anion in the body fluids. And 25% of the non-carbonic acid is excreted in the form of the titrable acids, and about 35% is excreted in the form of the acid combined with the ammonium. So now the major sites of the urine acidification are the distal as well as the collecting ducts, distal converted tubule and collecting tubules and collecting duct, even though the hydrogen ions is a secretions occurs throughout the nephron, because in the proximal converted tubule hydrogen ion that is secreted combines with the bicarbonate in the lumen to bring out the bicarbonate reabsorption, and so does not contribute the urine acidification. That we're going to see the further slides a little bit briefly. Now we have to know about this, how does our body prevent the potential of hydrogen change. So here the first of all we have to know about this bicarbonate buffer systems. There is a different types of the buffer system, so we have to easy to understand how can it's going to prevent the potential of hydrogen. So here first of all we are going to see the bicarbonate buffer system. It will be present in the large quantities and it will be present in the respiratory and renal system act on this buffer system. Most important is extracellular fluid buffer and it will be just maintain the 6.1. Bicarbonate buffer system. The bicarbonate buffer system consists of water solutions and contain the two ingredients, which is one is a weak acid bicarbonate and the bicarbonate salt such as a sodium bicarbonate. So bicarbonate is formed in the body of the reaction of water as well as the carbon dioxide. So here as a water and this here mentioned is the sodium bicarbonate and the bicarbonate to maintain the 20:1 ratio, and here the bicarbonate be there. So the HCl applies the sodium bicarbonate. It is given to as a bicarbonate and sodium chloride. So here with the help of this Anderson-Hasselbalch equations, so there is a water as well as a carbon dioxide is combined together is acting with the help of this carbonic anhydrase. This reaction is slow and exceedingly small amount of the bicarbonate is formed unless the enzyme carbonic anhydrase is present. This enzyme is especially abundant in the wall of the lungs alveoli where the carbon dioxide is released. Carbonic anhydrase is also present in the epithelial cells in the renal tubules where the carbon dioxide reacts with the water to form the bicarbonate. The bicarbonate ionizes weakly to form the small amount of hydrogen ion and is going to just release the carbonic acids. The protein are among all the most plentiful buffer in the body because of their high concentration, especially within the cells. The potential of hydrogen of cells, although slightly lower than in the extracellular fluid, nevertheless there is a changes approximately in the proportion to extracellular fluid. So potential of energy changes. Okay, now we have to know about this is abundant in the blood and the digestive fluid, and which is closed in the 7.4. The carboxyl group is gives up hydrogen, and amino group is accept the hydrogen ions. And here we are going to see about this one. The diffusion of the element of the bicarbonate buffer systems causes the potential hydrogen in the intracellular fluid to change when there are the changes in the extracellular potential of energy. For the reasons is going to be happen in the if the rate of the metabolic formation of the carbon dioxide increases, so the very carbon dioxide, the extracellular fluid is likewise increased. So similarly the changes in the pulmonary ventilation of the rate of carbon dioxide formation by the tissue can be changed. The extracellular fluid changes will be occurs. and followed by that we are going to see about the hemoglobin is going to be dissociation of the imidazole group and less efficient, and but the hemoglobin has a 38 is to 10 residue, the plenty of the hemoglobin will be present. And here now we are going to be see the isohydric principle. So what the principle is be mentioned is all buffer system work together, hydrogen ion shift from one buffer system to another buffer system. So next we are going to see about the respiratory systems. So we already told about this one. That is going to be mainly helpful of the body fluid level as the respiratory system and the renal systems. The second line defense of the respiratory system will be acts within the minutes is a maximum 12 to 24 hours. So bicarbonate will be produced is converted the water as well as the converted to as a carbon dioxide and excreted by the lungs. So alveolar ventilation also increases the potential of hydrogen, it will decreases. So this is also one of the reason. So this also is going to be just helpful to just maintain the acid base balance in our body. It's going to be cannot eliminated the fixed acid here. So that how just I mentioned as well as highlighted here. And followed by that we are going to see about the kidney buffer systems can eliminate the large amount of acids, can also excrete the base, can conserve the produces the carbonic acids ions, and most effective regulator of the potential of hydrogen. If kidney fails to maintain the potential of hydrogen, so the potential hydrogen balance is going to be failed, because this is only is going to be just eliminated the large amount of acids. So definitely if there is a failure of the kidney, so it cannot be able to just maintain or going to be balance the acid base balance. So here is the role of kidney. So what is the main role of the kidney? The lung will be excreted the carbon dioxides, so in the respiratory acids, and around the 12,000 to 13,000 millimoles per day. Kidney will be excreted the fixed acids. Why this is important? What is the reason? So now we have to know about this one. So because no other way to excrete these acids, so that is the reason is going to be excreted by the kidney. So this is a reabsorption of the filtered as well as the reabsorption of the filtered carbonic acids. So here we are going to be see the both the line defense. So the first line defense and second line defense. The first line defense, it is a chemical buffer, and second line defense is a physiological buffer. So what is the first line defense? So here what are the buffer system will just undergoes in the chemical buffer or as a first line defense. So bicarbonate buffer system, phosphate buffer system, and protein buffer system. So these are the chemical buffers acting as the first line defense, and second line defense is a physiological buffer. So now there is a respiratory mechanism, carbon dioxide excretion, and here there is a hydrogen ion excretions. So these two mechanisms comes under the physiological buffer, because there is a respiratory mechanisms is going to be expel the carbon dioxide, and is a renal mechanism going to be expel the hydrogen ions. So if there is a mechanism is a fail, is could be a fail to maintain the acid base balance, as well as to fail is a maintain the as a potential of hydrogen. So now we are going to see about the secretion of the hydrogen ion and the reabsorption of the bicarbonate ions by the renal tubules. So here the hydrogen ions will be secretion and bicarbonate reabsorption occurs in the virtually all part of the tubules except the descending and ascending thin limbs of the loop of Henle. So just keep it in the mind, so that the each bicarbonate reabsorbed and hydrogen ion must be secreted. So about 80 to 90% of the bicarbonate reabsorptions and hydrogen secretion occurs in the proximal converted tubule, so that only a small amount of bicarbonate flows into the distal tubules and collecting ducts. In the thick ascending loop of Henle, other 10% of the filtered bicarbonate is reabsorbed, and the remainder is the absorption takes places in the distal converted tubule and collecting ducts. So now we are going to see about this one. Bicarbonate is absorbed also involves the tubular secretion of hydrogen ions, but different tubular segments is accomplished in this task differently. So now we are going to be see about this one also, how it be just make the secretions, how can it's going to be just transported here. So here by the transport of the secondary active transport, the epithelial cells of the proximal tubule, the thick segment of the ascending loop of Henle and early distal loop, distal tubule, all secretes the hydrogen ion into the tubular fluids by the sodium hydrogen counter sub transports. So with the help of this one is going to be just exchange the molecules here. So here with the help of this we go on, the sodium is going to be enter inside, and by the way there is a hydrogen going to be just expelled outside. So this is a proximal conducted tubule is going to be just exchange the molecule with the help of this secondary active transport. And we are going to be see about this one, the buffering in the renal tubules. We told already about this in the hydrogen ion. So how can the hydrogen ion is going to be exchanges along with the sodium with the help of this is a secondary active transports. So now we want to be easily to enter. So what will happen? So see here, which already told about this, there is a carbon dioxide and the water is just combined together with the help of this carbonic anhydrase. It will be just releases from here. This is a type of enzyme, so it will be just make combined together to become as a bicarbonate. So once it's going to be just combined together, it's going to be just releases two molecules. One is a hydrogen ion separately and another is a carbonic acids. So once it's going to be just releases the hydrogen separately, is going to releases from the outside of the tubules. So it's going to be just mixed along with the sodium. So what will happen is going to become as a ammonia. So now by this way there is going to be just combined with the hydrogen will be just combined with the other molecules and going to be easily to excreted. So now we are going to be followed by that how is going to be just making the acidification of the urine. How can it going to be make the more acidic in the urine. So due to the urinary buffers, the nephrons cannot produce the urine. So it is a 4.5 to excrete the more hydrogen, the acid must be as a buffer. The hydrogen ion secreted into the urine tubules and combines with the ammonium. Okay, so now we are going to be know about this mechanisms. How can there is a hydrogen ion if it's going to be excreted more, so how can it's going to be become as a acidic. So the most important thing is that there is a removal of hydrogen ions and acidification of the urine. Role of the kidney to preventing the metabolic acidosis. Kidney plays an important role in preventing the metabolic acidosis. As the excretion of the hydrogen ions occurs by the three mechanisms. One is the bicarbonate mechanism, phosphate mechanism, ammonia mechanisms. By this mechanism is going to just releases as well as go to the urine make the acidifications. This diagram is maximum is going to be easily to helpful to how to make the acidifications. So here there is the acidosis, there is the increase the hydrogen ions concentration. So what will happen finally is the accumulation of the acids. So is a loss the bases. If we decrease the hydrogen ion concentration, here is the accumulation of the bases, the loss the acids. By this way this is going to be become under the acidosis as well as the alkalosis. So if there is a hydrogen concentration is going to be increases, so what will happen, this is going to finally it will be as a acidosis. If there is going to be as a decrease in the hydrogen concentration, so what will happen is the accumulation of the bases will be occur, so it is going to be decreases in the acids. And followed by that we are going to see about the acid base imbalance. If there is going cannot able to balanced, so what will happen, so what is this to called. So now we are going to see about is the potential of hydrogen will be decreased in the 7.35 is called as the acidosis. If it is more than the 7.45 is called as the alkalosis. The body responds to acid base imbalances compensations, and if causes in the metabolic, the change in the ventilation can help is the respiratory compensation. So because it's already told about this one, this is the not only is the main, but even though there is a some of the peripheral areas like as a respiratory system also is going to be helpful to just make the compensation of the acid base imbalance. So if causes a respiratory, the renal will be compensation. So it's going to be just make the given the compensation if there is fails in the renal system as well as the respiratory system. So now we have to know about this, what is the acidosis, what is the alkalosis. It would briefly have to mention about here. So there is a principal effect and CNS depression and generalized weakness. Severe acidosis causes disorientation, coma. Finally the person will be lead to death. Next, this is alkalosis is over excitability of the central nervous system and the peripheral nervous system. It can be causes a nervousness, a muscle spasm, or tetany, convulsion, loss of the consciousness, and lead the person will lead to the death. And followed by there is a circulation in between. There is a kidney and lungs and the circulation. This three is going to be playing the important role to maintain the acid-base balance as well as the acidulation of urine. So next we are going to see about this what is the difference between the as a acidosis and alkalosis. And here acidosis there is a two types. One is a metabolic acidosis and is a respiratory acidosis. And metabolic acidosis is due to the decrease in the bicarbonate, and this respiratory acidosis will be due to increase the carbonic acids. And here alkalosis the same. So metabolic alkalosis as well as the respiratory alkalosis due to increase the bicarbonate and due to the decrease in the carbonic acids. So now we are going to be see about this one as well. This respiratory acidosis. What is the respiratory acidosis? What are the causes? So the respiratory acidosis from the previous it is obviously that any factor decreases the rate of pulmonary ventilation, also increases the peripheral carbon dioxide and extracellular fluid. This causes an increases in the bicarbonate and hydrogen ion concentration, thus resulting acidosis. Because the acidosis causes by the abnormality in respiration, it is called as a respiratory acidosis. The person will be just affected by respiratory acidosis, so the person will be felt as a hypercapnia and depression in of respiratory center, emphysema, pulmonary edema, and pneumothorax. So by compensation is a renal loss of the hydrogen ion and retain the bicarbonate. So this is a compensatory mechanism. The person will be affected in the respiratory acidosis. And next we are going to see the respiratory alkalosis. Respiratory alkalosis is caused by the over ventilation by the lungs, as rarely does not occurs because of physical and pathological conditions. However, the psychoneuroses can occasionally cause the overbreathing to the extent that the person becomes alkalotic. So physiologic type of the respiratory alkalosis occurs when a person will be ascend to high altitude, the low oxygen content of the air stimulated respiration, which cause the excess loss of the carbon dioxide and development of the mild respiratory alkalosis. And again the major means the compensation or the chemical buffer of body fluids and ability to kidney to increase the bicarbonate excretions. So this is a respiratory alkalosis. And next we are going to see about this one as a metabolic acidosis. So the term of the metabolic acidosis refer to all the other type of the acidosis beside those causes by excess carbon dioxide in the body fluids. So this is four reasons. One is a failure of the kidney excrete the metabolic acids normally formed in the body, and formation of excessive quantity of the metabolic acids in the body, and addition metabolic acids in the body, ingestion or infusion of acids, loss of the base from the body fluids, which is the same effects adding the acids from the body fluids. So what are the causes? So there's a loss of the bicarbonate, diarrhea, renal dysfunction, accumulation of the acids, lactic acid, ketone bodies, and failure of the kidney to excrete the hydrogen ions. So what is the respiratory compensation for this metabolic acidosis? Means to increase the ventilation, if possible the renal excretion of the hydrogen ion. This is a compensation of the metabolic acidosis. So next we are going to see about this what is a metabolic alkalosis. So metabolic alkalosis when there is a excess retention of the bicarbonate or loss of the hydrogen ions from the body, this results the metabolic alkalosis. Metabolic alkalosis is not nearly as common as a metabolic acidosis, but some of the causes metabolic alkalosis are will be present here, and for the excess vomiting, use the diuretic, and severe dehydration. So what are the compensation for the metabolic alkalosis? And here there's a compensation to make the person be hypoventilations. So this is a respiratory compensation which is present in the metabolic alkalosis. And followed by that we have to know about this what are the treatments of the acidosis or alkalosis. The best treatment for the acidosis or alkalosis is to correct the condition that caused the abnormalities. This is often difficulty, especially in the chronic disease that causes the impaired lung function or kidney failure. Is there is a circumstance various agent can be used by the neutralize the excess acid or base in the extracellular fluid. To neutralize the excess acid, large amount of the sodium bicarbonate can be ingested by mouth. The sodium bicarbonate is absorbed from the gastrointestinal tract into the blood and increase the bicarbonate portion of the bicarbonate buffer system, thereby increasing the potential of hydrogen towards the normal. The sodium bicarbonate can also be infused intravenously, but because of the potential of dangerous physiological effect of such treatment, so other substances are often used instead of the such as a sodium lactate and sodium gluconate. So the lactate and gluconate portions of the molecules are metabolized in the body, leaving the sodium and extracellular fluid in the form of the sodium bicarbonate, and thereby increasing the potential of hydrogen of the fluid towards a normal. For the treatment of the alkalosis, this ammonium chloride can be administered by the mouth. When the ammonium chloride is absorbed into the mouth, the ammonia portion is converted to the liver into the urea. This reaction liberated the hydrochloric acids, and which immediately reacts with the buffer of the body fluid to shift the hydrogen concentration in the acidic direction. Ammonium chloride is occasionally infused intravenously, but the ammonia is highly toxic, and this procedure can be so dangerous as if any another substances used occasionally is in the lysine monochloride. So this is the treatment of the acidosis as well as the alkalosis. And here there is the clinical measurements as well as analysis of the clinical acid disorders will be takes places. So here the proper therapy of acid-base disorders requires a proper diagnosis. A simple acid-base disorders described previously can be diagnosed by analyzing the three measurements from the arterial blood sample. So what are the measurements? Means there is a sample is the potential of hydrogen, plasma bicarbonate concentration, and peripheral carbon dioxide. So the diagnosis of simple acid-base disorders involve the several steps. So now we have to know about this one. So one can determine whether there is a disorder in the acidosis or alkalosis. Yeah, potential of hydrogen is less than 7.4 indicates the acidosis, where there is a potential of hydrogen is greater than the 7.4 is indicates the alkalosis. I hope you will understand this classes. If you have any doubts, any clarification, please free to ask about this one. And here finally I have to just mention about the SIGARD-ANDERSON nomogram graph is just mention about this one about the respiratory acidosis, metabolic alkalosis, and metabolic acidosis and respiratory alkalosis. So I hope you will be understand these classes. If you have any doubt, if you have any clarifications, so please comment below, and we have to text in the group also. So if you have any doubts, just make the clarifications. And finally we have to see the summary is the power of potential of hydrogen and acid base buffer, importance of the body and potential of hydrogen, maintenance buffer system of our body, and role of the respiratory system in the potential of the hydrogen balance, role of the kidney in the potential of hydrogen maintenance. So what is the acidosis and what is the alkalosis? Actually, if you know about this acidic as well as the alkaloid, so definitely you will be easily to understand the concept of the how will be just maintain the acid base balance, and how can the will be acidification urine will be just formed. So because it be just it fully depends upon this is going to be acidosis as well as alkalosis. So if there is a acidosis, if there is a alkalosis, so if there is a acid, if there is a base, so it will be increases. So what will happen? So what are the causes, what are the symptoms, what are the compensation mechanisms, and what is the what is the therapy have to be followed for to make the compensation. So these are things is mainly we have to just go through this one. If you have any doubt, just again have to just mention, you have to free to ask, and you have to just comment, you have to put the questions, and if you have any clarification, just comment below here or in the group. Okay, thank you.